Hello and welcome. Today we're diving deep into autoimmune hepatitis, a chronic disease where your body's immune system mistakenly attacks your liver. We'll explore what causes it, how it develops, and what you can do about it. So, let's get started. The exact cause of autoimmune hepatitis remains a bit of a mystery, but experts believe it's a combination of genetic predisposition and environmental triggers. Certain genes make some individuals more susceptible. These triggers could be viral infections like measles, herpes simplex, or Epstein-Barr virus, certain medications, or even exposure to environmental toxins. Essentially, in susceptible individuals, these triggers may set off an autoimmune reaction against the liver cells. Now let's talk about how this disease unfolds. In autoimmune hepatitis, the immune system, specifically T cells and antibodies, targets liver cells called hepatocytes. This attack causes inflammation and damage to the liver. Over time, this chronic inflammation can lead to fibrosis, which is scarring of the liver. If left untreated, this fibrosis can progress to cirrhosis, a severe scarring of the liver that impairs its function. Cirrhosis can ultimately lead to liver failure. Autoimmune hepatitis is relatively rare, but it affects people worldwide. It's estimated to affect about 10 to 20 people per 100,000. Interestingly, it's more common in women than in men, affecting women about 4 times as often. It can occur at any age, but there are typically 2 peak periods between the ages of 10 and 30, and between the ages of 40 and 60. The signs and symptoms of autoimmune hepatitis can vary widely from person to person. Some people may experience no symptoms at all, especially in the early stages. Others may have mild symptoms like fatigue, abdominal discomfort, joint pain, or skin rashes. As the disease progresses, more noticeable symptoms may appear, including jaundice, yellowing of the skin and eyes, an enlarged liver, dark urine, pale stools, nausea, vomiting, loss of appetite, and weight loss. In severe cases, complications of cirrhosis like ascites, fluid accumulation in the abdomen, and hepatic encephalopathy, brain dysfunction due to liver failure can occur. Diagnosing autoimmune hepatitis involves a combination of blood tests, imaging studies, and sometimes a liver biopsy. Blood tests can reveal elevated liver enzymes, such as ALT and AST, indicating liver damage. They also test specific autoantibodies, such as antinuclear antibodies, SINA, anti-smooth muscle antibodies, ASMAN, and anti-liver kidney microsomal antibodies, anti-LKM1. Imaging studies like ultrasound, CT scans, or MRI can help assess the liver's structure and identify any signs of cirrhosis or other complications. A liver biopsy, where a small sample of liver tissue is examined under a microscope, can confirm the diagnosis and assess the severity of liver damage. Autoimmune hepatitis is primarily classified into 2 main types, type 1 and type 2. Type 1 is the most common form, accounting for around 80% of cases. It's characterized by the presence of antinuclear antibodies, AN and/or anti-smooth muscle antibodies, SMM. Type 2 is less common and is characterized by the presence of anti-liver kidney microsomal antibodies, anti-TM1. There is also a less well-defined type 3, which is less specific and harder to diagnose and classify. The primary goal of treatment for autoimmune hepatitis is to suppress the immune system and reduce inflammation in the liver. The cornerstone of treatment is immunosuppressant medications, typically corticosteroids like prednisone or budesonide. Azathioprine is another immunosuppressant often used as a steroid-sparing agent, allowing for lower doses of corticosteroids. In some cases, other immunosuppressants like mycophenolate mofetil or cyclosporine may be used. Treatment is usually long-term, and regular monitoring is essential to assess liver function and adjust medication dosages as needed. In severe cases of liver failure, a liver transplant may be necessary. Unfortunately, there's no known way to completely prevent autoimmune hepatitis. Since the exact cause is unknown, there are no specific measures to take. However, avoiding unnecessary exposure to potential triggers, such as certain medications or environmental toxins, may be beneficial. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive alcohol consumption, can also support overall liver health. The prognosis for autoimmune hepatitis varies depending on several factors, including the severity of the disease at diagnosis, the response to treatment, and the presence of cirrhosis. With early diagnosis and effective treatment, many people can achieve remission and prevent progression to cirrhosis. However, if left untreated, autoimmune hepatitis can lead to cirrhosis, liver failure, and the need for a liver transplant. Recent research is focused on developing more targeted therapies with fewer side effects. Scientists are also exploring the role of genetics and environmental factors in the development of the disease, hoping to identify new ways to prevent and treat autoimmune hepatitis. Thanks for watching, and remember to consult with your healthcare provider for any health concerns.